HEALTHCAREONOMICS, changing healthcare by changing the way you think about healthcare.
Experts in Business, 620 AM, KEXB.
All right, welcome back. 4:47 on this Wednesday afternoon. Let's talk healthcare. Dr. Kevin Wacasey joining us on the line. The website, HEALTHCAREONOMICS. It's been way too long, my friend. Welcome.
Hey, happy winter. I think winter is finally coming. Yeah,
finally here.
Crazy.
A nice ad to your website, by the way. All these videos and stuff. I've got a little sample from one here. I want to play it to give our audience an idea of what we're doing.
Think about healthcare. Why is my health insurance going up so much every year?
I don't know. Tell me.
Many Americans hold the Affordable Care Act solely responsible for rising health insurance premiums. But does it really deserve all the blame?
Does it, Kevin? Does it deserve all the blame?
Well, it deserves 20%, I should say 80% of the blame, because as I discussed in that video, one of the major reasons why health insurance premiums have gone up, aside from the fact that, there's now a national law that requires virtually everybody in the country to buy this product, which is going away in January. The individual mandate's been canceled. But aside from that, being forced to buy a product is automatically guaranteed, in my mind, to raise the price of that product. But another huge reason that never gets talked about is the fact that the Affordable Care Act made health insurance very unaffordable. And the reason why is because it changed the payment model. It changed how health insurers get paid in a major way. And this goes towards commission. You know about commission-based professions and jobs and occupations like food servers, waiters and waitresses at restaurants. Real estate agents get paid on commission. And basically, the more you sell or the more you push through money-wise, the more you get to keep, because you, as being paid on commission, you get paid a percentage of whatever money goes through your sales hands, so to speak. Well, the health insurance industry created for itself with Obamacare, and it's my contention that the health insurance industry wrote Obamacare, all right? They wrote the Affordable Care Act. Congress just passed it. But they put in there something called the medical loss ratio. Now, on the surface, Brian, this sounds really good, and I remember this getting applauded at the time it got passed. And it's part of the Affordable Care Act that says health insurers must spend 80% of whatever they take in. Like, let's say they take in $1 billion in health insurance premiums. They have to spend 80% of that, $800 million, on health care claims. In other words, they have to spend a certain percentage of what they take in on health care. Well, what that means is that they're incentivized to pay as many health care claims as they can, because they've got to meet this number, right? They have to pay 80% of their money that they take in. But what also ends up happening is that if they pay out 80% of their money towards health care claims, guess what? They get to keep 20% of it. So this really does not incentivize the health insurance industry from saving any money. Now, keep in mind, before Obamacare, health insurers largely operated off of a managed care basis. In other words, you go to the doctor, they order a test, they order an imaging study, an X-ray or an MRI. The claim got delayed or denied or just they didn't take care of it. They made their money back then by holding on to as much of it as possible. But now they've kind of switched over into this role where with this commission basis, with this medical loss ratio, now the health insurers are making tons of money by just pushing the money through towards the health care providers. And this is why you're starting to see, six-figure hospital bills for, regularly routine stuff. I mean, a gallbladder operation that's now getting billed out at $60,000, $70,000 with an overnight stay. And it's because the health insurance companies are paying these claims.
Dr. Kevin Wacasey joining us on the phone. The website, healthcareonomics.com, healthcareonomics.com. The other day I heard a stat. I had a friend go get some blood test, and the blood test had a price of about $9,000. Is that no? Explain that one to me.
Well, again, as I often say, it's not the costs of healthcare that are outrageous; it's the charges. So you can charge whatever you want to charge, and it used to be, okay, again, go back to the old HMO managed care industry days before 2010. And it used to be that I, as a doctor, could charge ABC Health Insurance Company whatever I wanted to. I could charge them $1,800 for a urine drug test or $9,000 for a blood test. They wouldn't pay me that. They would pay me whatever amount we had contracted and agreed upon, and it'd be a fraction of whatever I charged them. But now, again, health insurance companies are motivated, they're incentivized to pay these large claims because, A, it helps them pay their 80% towards healthcare claims, and B, it lets them keep 20% of whatever they're pushing through. Imagine a waiter at a restaurant that you're not paying for the food. They're going to serve you the entire menu because they get to keep 20% of it.
That's true. That's a good point.
Yeah.
Good point.
Yeah.
So how does, where do you see this? I mean, because I know that is it off the books now that you get that if you don't have health insurance, that you're not being taxed now? Is that officially off the books?
January 1. Now, my understanding is the Trump administration is not enforcing the rule now, so I don't know about people who go without health insurance for 2018, which, by the way, I don't recommend that. I think health insurance is a valuable and wise thing to have. It's just a shame how it's being usurped and how it's being, like I said, it's not the problem. The problem with health insurance these days isn't the coverage. It's not high deductibles. That's what insurance is supposed to be. The problem is the cost that you have to pay to have those high deductibles. Mm-hmm. When you're paying, you can insure a $1 million home for a few $1,000s a year. Mm-hmm. Why can't you insure yourself for, with a $10,000 deductible for a few $100s a year?
It's a great point.
It's a great question.
Real quickly, let me ask you before we run out of time. I asked a girl the other day why she was going to vote for Beto. And she said, well, I heard that Beto was good for teachers. And I thought, and it reminded me of the conversation we had about the teachers, what's going on in Texas in regards to benefits and stuff and their health care plan. What is the latest on that? And can you recap that for me real quickly?
Yeah, sure. Texas teachers, I do a blog post every summer about their health insurance plan, which is ran through the Teachers Retirement System of Texas. And actually, I wrote about this in my first book as well, The Guide to Buying Health Insurance and Healthcare. And I lament the fact that the state government, which is the Teachers Retirement System of Texas, is a quasi-governmental entity, is really taking advantage of Texas teachers by a number of things. They're charging them out the wahoo for their health insurance plans, but then they're tricking them into buying these updated or upgraded, they're not silver and gold level plans per Obamacare, but I label them as silver and gold just to give you an idea of what's good and supposedly better and supposedly best. And the problem is these better and best plans are supposedly that way because they end up costing these teachers a lot more. In other words, Brian, would you spend $3,200 extra to go from a bronze level plan to a gold plan if you could take $1,500? I asked a woman at a party last night I went to about this, and she kind of looks at me and she goes, I might. And I said, let me rephrase that. Would you put $3,200 in a slot machine that might pay you back $1,500 if you win? She goes, oh, of course not.
Yeah.
Well, that's the problem with health insurance is people don't understand that's what they're doing.
Yeah.
They're shoveling more money in than they could possibly ever get back if they got hurt or sick.
Yeah. The website's healthcareonomics.com, healthcareonomics.com. You got a lot of cool videos on here, some books, some audio stuff. You've got your Dr. Wacasey's equation. I love that. You got to come back on the show, hang out.
Yeah, sure. I wanted to remind you the app is up for both the iTunes and the Android phone. So open enrollment starts tomorrow, so the app can help people save lots of money. And please subscribe to my YouTube channel. That's where I'm putting all the videos these days, is on the HealthCareOnomics YouTube channel.
I love it. I'm going to do it as soon as I can get on YouTube. I'll subscribe to it. We're running a little bit out of time. I appreciate you joining us on this short notice, and we'll come on the show, hang out.
Thanks, sir. Have a great day.
Dr. Kevin Wacasey, HealthCareOnomics. He's fun. He's fun to listen to.
That's good stuff.
He loves to break it down in like layman terms, you know.
And it's horrifying when it gets broken down for you.
But he'll tell you exactly, what an MRI costs.
Yes.
And he's like, why? You can go pay thousands over here, or you can get it done for about $89 over here. Yep. So he's really, really good. HealthCareOnomics.
Those back doors are very available if you know how to look for them.
Yep. He's amazing.
Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the HealthCareOnomics YouTube channel and visit healthcareonomics.com.